Roger Barrow here with Prep Journalism, here with Mr. Kyle Kutsup, athletic trainer at St. Peter's Prep. How are you?
Good, how are you?
Good. Can I ask you a few questions?
Yeah.
Could you briefly define what a concussion is?
So a concussion is a mild traumatic brain injury. So basically what happens is whether you get hit or you hit the ground or whatever, hits your head, your brain kind of jostles around inside of the skull. So there's two locations where you kind of get the impact. One where you get hit initially, and the other where your brain hits the inside of your skull. So it's coup and counter coup.
What would you say are the most common symptoms of concussion?
Obviously a headache. A lot of times you'll see blurred vision, dizziness, some nausea, confusion. There's a laundry list of symptoms, but those are like the most common.
Right. How often do you get an athlete come into you because they've sustained a concussion?
Actually sustained a concussion. I wouldn't say weekly, but probably bi-weekly. I'm doing at least an eval. I'm not saying necessarily that they have a concussion, but I'm doing at least a concussion evaluation, maybe bi-weekly.
What would you say is the sport that sends in the most kids with concussions?
Either rugby or football. Yeah.
All right. What kind of treatment do you use to help ease the pain and get them back as quickly and healthy as possible?
So treatment is kind of a hard question for concussions because there isn't a definitive treatment out there for people who sustained a concussion. A lot of times rest is considered the best medicine. I know there's studies going on right now that are saying maybe it's not, maybe we need to push people a little bit. So it's something that's constantly being researched. Right now, the policy that we have in place is that you need to kind of shut down from everything. So anything that limits the stimuli that your brain can experience, so TV, video games, cell phone use, studying, computer, anything like that that requires you to use your brain, your sight, your hearing, we want you to kind of shut down. So basically it's just bed rest for 7 days before, and at least hopefully in that 7 days you become symptom free. If not, then we start to explore different options.
One of my previous interviews I was briefly informed about the 3 concussion rule. Could you expand on that just a little bit?
So, nationally there isn't necessarily a rule. A lot of times, once you leave prep, different colleges will have their own rules and whatever it may be. But here at prep, I'm under the supervision of a physician, Dr. Gonzalez. And his rule is basically after your 3rd concussion, to continue to participate, we want parental permission, kind of a waiver per se.
Right.
And then after that, if you have a 4th concussion, we don't let you participate just for the sheer safety.
Right. So we've all heard and seen the scrutiny that football is getting nowadays about safety.
Mm-hmm.
In your opinion, is there anything the sport can do to help protect its players?
I think that we've come a long way in the sport, just in general with the way the rules are about hitting and, defenseless receiver and stuff like that. But there are a lot of, advancements in the helmets, and as much as helmets are great, they don't do a whole lot to keep that brain steady inside of the skull. And until we can kind of really figure out a way to keep the brain from moving, which is kind of a hard thing to do, we can change the rules and better the equipment, but we still have to get to the core of the problem. I know recently they're doing a lot of research. The NFL is sponsoring some research, NCAA, across the board. There's a lot of research going on. And one of the newest things that's pretty cool is they're studying woodpeckers, because woodpeckers obviously go back and forth frequently and they don't sustain concussions. So they're trying to figure out what stops them from having a concussion, and they've developed this band that kind of goes around your neck, and it has to do with the carotid artery, and it helps store more blood around the brain, so it kind of acts as an airbag, and it's pretty interesting stuff. So as long as we continue to do this research, and I think the NFL and football across the board is an advocate. I know we see a lot of times where there's pushback, obviously, but they want to protect their players, and everybody out there wants to just make sure it's safe for everybody.
Yeah. Major League Baseball has recently made a protective cap where there's padding in front of the cap for pitchers.
Mm-hmm.
Do you think that should be made mandatory for high school players?
It's tough to say. Obviously, it's a freak accident if a ball comes straight back at you. And I think it wouldn't be a terrible idea. I don't necessarily know, like I said, that's going to prevent a concussion. If anything, it'll help, with fractures, skull fractures. So it wouldn't be a bad idea. I mean, I'm always an advocate for something that'll prevent injury. So,
Right.
I mean, why not?
Yeah. Do you think, in your opinion, that repetitive concussions at the high school and collegiate level can have a long-lasting effect on an athlete?
Yeah, I would definitely agree that it does. And I mean, research is coming out and showing that CTE is a legitimate concern. And especially if you're talking about multiple concussions in a short period of time. And I mean, high school is only 4 years if you go on to play, and if you have 6, 7 concussions in that time frame, that's a lot of brain damage, to be honest with you. And so I think it does start to have a lasting effect.
And just lastly, do you believe that nowadays the risk is greater than the reward in regards to playing a sport like rugby or football?
It's really, I mean, it holds a place in our society. It's hard to, culturally change what it is. And I mean, I personally enjoy football and rugby, and I'd be sad to see it go. Do I think that the risk is greater than the reward? I think as long as we continue to advance, and make the changes necessary to make sure that everybody's safe, I think that we can, make it manageable for everybody to continue playing and also, have a safe environment.
That's it. Thank you.
You're welcome.
Yeah.